All right, welcome into Bartholomew Town. I'm Bill Bartholomew. We continue to follow up on a program that has we've talked about, and I would recommend anybody who's interested just search "Eat Well, Be Well" wherever you're listening right now. You'll find previous episodes on this topic. But before we get into our discussion, you'll recognize one of our voices today, that's for sure. But we have someone who has not been on the show before. So, Chris, if you want to introduce yourself, and we'll associate the voice with the human, and then Dr. Nunn.
Yeah, absolutely. Hey, happy to be here. And it's my name is Chris Buchanan, and I'm with Walmart. I do director of public affairs and government relations with Walmart, and I cover the six-state New England region.
Awesome. And Dr. Amy Nunn, a voice familiar to many on this and other broadcasts, but if you want to introduce yourself as well for those who may not be familiar.
Good morning. I'm Amy Nunn, and I am CEO of the Rhode Island Public Health Institute.
All right, let's talk about Eat Well, Be Well and what it is. What's the history of this program and how it came to be and why it became a priority for you, Dr. Nunn, as a public health leader?
Well, it's important for us to have ways to help people live their healthiest lives and to eat healthy diets. As everybody knows, when you go to the grocery store, food has gotten increasingly more expensive, and sometimes fruits and vegetables are out of reach for people with limited means. And so this program is designed to promote healthy eating among people who use SNAP. So SNAP is like uh, it's a federal program that's designed to alleviate hunger. It's called the Supplemental Nutrition Assistance Program, and we piloted a program called Eat Well, Be Well that doubles the value of the dollar when people buy fresh produce with their SNAP benefits. It's essentially a creative way to make eating healthy easy and affordable for many Rhode Islanders.
And this dates back to the original concept funded in 2022, an $11.5 million appropriation that came from the American Rescue Plan Act. So in other words, COVID dollars funded this, but it's now been extended a $4.1 million appropriation in the fiscal year 27 budget. There's going to be an event later today that will include leaders from the Senate and the House, as well as those who advocated and worked on this project. The program continues to be active in 36 participating retail locations, including Stop and Shop and Walmart locations, and the West African Superstore in South Providence. So looking at it from the standpoint of Walmart's lens, why did Walmart decide to opt into this pilot program here in Rhode Island, Chris?
Yeah, absolutely. I'll take that question, obviously, but yeah, Walmart was proud to participate because the program it lines up directly with our company's purpose, and not to sound like a commercial, but helping people save money and live better. That's what we're all about as a company. So, for a lot of families here in Rhode Island, the issues not really whether they can want to make healthy choices. I mean, they know they want to put fresh fruits and vegetables on the table. I think everyone has a general knowledge of that. The challenge is often affordability, as you touched upon, especially when household budgets are tight. So the Eat Well, Be Well program is a very practical program. It helps SNAP customers stretch their grocery dollars when they purchase eligible fresh produce, and it does so in a way that's simple for the customer. There's no separate enrollment process. Customers can shop as normally as they would, and the incentive is applied through the EBT system at checkout. So it really made a lot of sense for our company to get on board and help the program. And it's also a really strong public-private partnership. Rhode Island state leaders obviously are involved. DHS, Rhode Island Public Health Institute obviously is involved. Community partners and so it was a really, nice program to be a part of and continue to be a part of, especially with the extended funding. Walmart's role was to, help make the program available in the places where Rhode Islanders are already shopping for groceries, at our local stores here in Rhode Island. So that's where we really, we're able to be helpful here and offer convenient access, fresh produce, and of course, low prices.
Right. And Chris, you touched on something, the logistics here. Let's get into that. Let's start with the practicals here. This is so important. There's no extra sign up. There's no, hey, go to this portal, enroll here. What was that password again? Anything like that. Or secondary or auxiliary card you've got to pull out. There's nothing like that. SNAP recipients just do what you always do. You just automatically receive the incentive at checkout. Dr. Nunn, why, from a psychological and practical standpoint, was that an important component here?
Well, we wanted to bring this program to where people shop, and that's at grocery stores. And we wanted to make it seamless and easy. Sometimes it's really hard to sign up for public assistance programs. And we wanted to work with partners who do a great job reaching people who need help. And so this program happens automatically at the checkout. So, what does that mean? I throw a bunch of fruits and vegetables into my cart. Let's say that I spend $50 on my vegetables, fruits and vegetables for my family for the week. I get $25 applied back onto my EBT card automatically. It's kind of invisible to the person at the register, and but you get it's applied automatically, and it shows up on your receipt, so it goes right back onto your EBT card. So that means you would have 25 more dollars to spend wherever you want. It doesn't have to be at Walmart or Stop and Shop, because you made the healthy choice by buying fruits and vegetables.
Let's look at this from the logistics side of the retailer, Chris. So in theory, someone comes into the store, comes into a Walmart location, and they're doing their grocery shopping, and the incentive is automatically applied. It's basically like a coupon from the retailer point of sale standpoint. You don't have to jump through a bunch of hoops. The system already exists, but there are still, I understand, there's a lot of time and resources that were required on the front end just to get that point of sale system
Sure.
where it is now, where it can administer the program without having to jump through hoops at every single transaction. So talk about that
Right.
process. What was that like? And for other retailers that are maybe want to follow your lead here and consider opting into the program, even in a competitive environment, what's your recommendation to them?
Right, absolutely. No, I appreciate that question. It's a great one. In a program like this, it definitely requires coordination and a lot of it. The customer experience needs to be simple. We know that. And making that happen behind the scenes takes a lot of work. And so, retailers need to make sure eligible items are identified correctly. The point of sale system can recognize qualifying purchases, and the EBT incentive is applied accurately and consistently. So it definitely took a lot of work. The strength of the Eat Well, Be Well is that it's a low barrier. Customers can shop for eligible fruits and vegetables, use their EBT card, and the incentive works through the checkout process. So, I guess my advice to other retailers would be to really lean into the partnership very early in the process, work closely with the state and the program administrators, public health partners, folks I mentioned a little bit earlier, and especially internal technology operations teams, to get really just to get everyone on board and pulling in the same direction. So
Mhm.
that, the more alignment there up front on eligible products and the customer experience and reporting and troubleshooting as well. The better the program will work for everybody. So it's, once customers are in the stores, it works seamlessly.
Let's As Rhode Island's first ever member-owned credit union, Navigant Credit Union has been a staple in the local business community for more than 108 years. Today, Navigant is a $3.4 billion institution serving more than 136,000 members across 25 physical branch locations. But since its founding in 1915, the mission has never changed. Navigant Credit Union's team of financial professionals have remained committed to improving the financial well-being of the families, businesses, and communities they serve across Rhode Island. Learn more at navigantcu.org. Bartholomew Town is proud to partner with Waterfire. Visit waterfire.org. Half Street Group brings a new generation's perspective to leadership communications, strategic public relations, and digital marketing. Half Street helps organizations and leaders take control of their own stories and manage their reputations. They get results for their clients by focusing on audience message and culture, and by leveraging their decade-long relationship with media and opinion leaders in the Ocean State and throughout New England. And by the way, join me and Half Street Group founder and president Mike Rea for a conversation every month about news of the day, the hottest media analysis, and a look behind the scenes at how impactful leaders drive conversations. Learn more at halfstreetgroup.com. Bartholomew Town, proud to partner with the University of Rhode Island Online. Are you ready to take the next step in your career? At URI Online, they offer business and leadership-focused programs designed to fit your life. Whether your goal is to advance your career in fields like public administration, supply chain management, or training and development, their online programs provide the flexibility you need with a high-quality education you deserve. You're going to learn from experienced faculty and collaborate with a network of professionals, all from the comfort of your home or wherever life takes you. Visit uri.edu/online to explore programs and start building your future today. URI Online, learn anywhere with us. Bartholomew Town is proud to partner with Newport Film. Visit newportfilm.com. Follow me on Instagram at Bill Bartholomew. Back to the notion here of this being originally funded ostensibly through COVID money, Dr. Nunn, and then in turn a pilot, this pilot program and an evaluation of the program itself. The Rhode Island Public Health Institute, your organization, led that evaluation of the Eat Well, Be Well program during the pilot stage. And over that 2-year time frame, you reviewed comprehensive data, and that data came from the State Department of Human Services and by private retail partners, and you collected feedback from more than 3,500 Rhode Islanders through focus groups and online and in-person surveys. You found that since 2024, more than 106,000 Rhode Island households have benefited from the Eat Well, Be Well program, earning about $10 million in additional SNAP benefits by buying fresh produce. So that basically says, yeah, this worked. How much did this work? How big are those numbers? And how much does that impact resonate in terms of the need to continue moving with this program?
Yeah, well, we know that 76% of SNAP recipients ever use the program, and 65% of people use it regularly. That means that they have used it, more than at least once or twice a month in the last 3 months. So the proof is in the pudding of how people use things. And, our data shows, our sales data shows that people are using it. When we surveyed people about their experience, we also found that it had a huge impact on 2 very specific populations: the elderly and also families with kids. Um, all reported that they were eating more fresh vegetables and fruits, and it was particularly impactful for children. So, this program is reaching our most vulnerable residents and helping them eat healthier foods.
Yeah.
That's something we're really proud of. It's if you think about it, we're 40 or 50 years into the obesity pandemic, and a lot of Americans still don't know what to eat. We're getting a lot of crazy messages from the federal government that actually don't promote healthy eating. Um, and we know everyone can agree that eating more fruits and vegetables is good for their health. This is a way to encourage people to live their healthiest lives, and we've done it by partnering with the private sector. So businesses often do a lot better than sometimes the government or nonprofit organizations in knowing how to reach people. And by partnering with Walmart and Stop and Shop, we were able to reach many of the people who would most use SNAP around the state and encourage them through financial incentives to make healthy choices at the checkout.
Yeah, when you look at the success here on just a numbers basis, Dr. Nunn, I know we're just into the early phases of new funding from the Rhode Island standpoint for the fiscal year 27 budget, but what other areas can we see this expanded to? Healthy water, healthy access to, I don't know, any number of other essentials. Can you see this type of program expanding? And I'll ask the same question to Chris from the retail side, because it would take 2 to tango here.
Well, this is kind of interesting when you think about this is what economists call behavioral economics. Financial incentives are a great way to promote behavior change. This is the first time that anything like this has been done to scale, and it has worked on a population level. So, there's some evidence that shows it has worked for other things too, like smoking cessation, even drug use. And so I think when we think about how we are, when we think about policies, we don't necessarily always want to be punitive, right? There are ways that we can incentivize people to change their behaviors to give them rewards for making healthy choices. And this is a great example that helped a lot of people living in poverty access healthy foods.
And Chris, do you think this can expand into other areas beyond fruits and veggies in terms of incentivizing healthy choices?
Absolutely, and I think the doctor did an excellent job summarizing it. Any program that Walmart looks at it, we look at it through the customer lens. So this program, obviously it provided SNAP customers, more purchasing power for fresh fruits and vegetables, but that could easily translate to other products. And yeah, I think this could be a nice starting point for other areas to pursue. Absolutely.
Yeah, there's a disparity right now that's not talked about. I don't know if it's even studied, but it comes from those who work for certain, usually tech or biotech or meds and eds type of firms that provide oftentimes a stipend for recreation, a stipend for recreational activities. I was with somebody who was like, "Oh yeah, I just bought a new paddle board with my stipend for this month," and they're healthy, and they also get shoes, and they get a gym membership. This is a huge disparity in our society that many people's employers may not even provide them with time off sufficient to be anywhere near engaged in that kind of healthy activity, while other people are motivated to the extent that they're given money to do so. So I wonder if there's a space where public health and retail kind of fill that gap to say, hey, come to Walmart and get X product that is designed for a healthier lifestyle in the sporting goods section, perhaps. And then then that is funded in turn by a combination of private and public dollars, just to get people moving and get people connected with each other in third spaces. Is that pie in the sky? Once again, last question here. I promise, Dr. Nunn and Chris.
I think it's a great idea. We just had a step challenge at work where we asked people to record all their steps and make an effort to take more. And I usually put in at least 4 miles a day on foot, but it prompted me to take a lot more. And we started having walking meetings. And I think just we had like a public tally board. And we were joking about calling it the wall of fame and shame, about how many steps everyone took. But sometimes incentives like that can really prompt people to make small lifestyle changes that can help them live healthier lives. We started having walking meetings and normalize that in our office. So I think there are
Mm.
lots of things you can do. And when you have the private sector, working in concert with you, you can do so much more. I never would have imagined in a million years that I'd be working with Walmart. Um, I
Glad
am
we are.
originally from Arkansas, but Walmart's the largest, I believe, the largest retailer of produce in the whole world. And so when I think about
Mm.
how to scale things, I think about working with the companies that reach the most people. And that made a lot of sense.
Yeah. Chris, last word on that. You already said that you think this can kind of scale in different directions. Obviously, there's a reality,
Sure,
there's an
sure.
economic reality, there's a business reality, and we can all wish that we all had an indoor. I wish I had an indoor basketball court at my place. I can run up and down the floor every night. But let's be honest. But
You and me
but
both.
but totally. But conceptually, the idea is something to explore potentially going forward. Is that fair to say in terms of how retailers and stakeholders in public health, and then obviously from a dollar standpoint, governments can kind of work together to create a
Sure.
better public health environment for everybody?
Yeah, absolutely. I'm glad you called that out too. And, and again, the doctor did a nice job summarizing as well. And, I'd say, Walmart as a company, we're always looking outside the box and where we could, partner with different groups. And, this is just a really, really strong example of that. Government, public health leaders, community partners, retailers, obviously, like Walmart, like my own company, each doing their part. So, and again, no single organization can do it alone. So it was nice to see all the partners come together and put this program together. Um, And yeah, at the end of the day, Walmart tries to stay focused on the customer. That's what it's all about. And if that translates into broader policy arenas and different ideas that come up to expand the program, yeah, we're in. We'll definitely look at that seriously, and look to partner with other groups and organizations moving forward. So absolutely, this was a really great program to be a part of, and one we continue to grow, and to your point, look towards other areas of expansion. So it's been wonderful.
Chris Buchanan with Walmart, Dr. Amy Nunn, Rhode Island Public Health Institute. It's happening. It's effective, and it's something that we should be talking about more and more. Eat well, be well. Thanks so much for your time today, both of you.
Thank you.
Thank you.
Always great to check in with our friends from Navigant Credit Union. Molly Pastori serves as the first vice president of marketing and member experience at Navigant. And today we're going to talk about the Embark accounts. We've talked about this before, but Molly, explain what the Embark accounts are and why this is a great opportunity for teens, or really anybody of any young age, to get into managing their own money.
Sure. Thank you, Bill. Nice to be on with you. The Embark account is a digital first checking account. It's designed for teens and young adults, ages 13 to 22. Takes just $10 to open. There's no monthly fees. It comes with some really great features like card controls, mobile alerts, mobile check deposit, and it has a great roundup to savings feature. And it's really a great first step towards that financial independence for teens and young adults. And really, we talk about summer is the perfect time to start good money habits. Whether teens are earning from a summer job, chores around the house, the Embark account helps them manage their money in a smart and safe way. It's designed to help them spend and save, all while building financial confidence and independence. And additionally, the account is great because it offers tools to support everyday money management. It tracks spending, you can set budgets, and again, it encourages that savings with that roundup feature. So, also with mobile deposit and real time alerts, teens can handle their finances on the go and never have to visit a branch if they don't want to.
And of course, you enter into the Navigant CU ecosystem at a
Mhm.
young age, which in and of itself is a great opportunity for anybody out there. Molly, if somebody is hearing this right now, maybe the teen themselves, or a parent, or somebody who says, this is perfect for somebody I know, what's the best way for people to begin that sign up process?
Sure. So super easy. You can open the account online at navigantcu.org. Or you can stop by any one of our 25 branch locations, or you can call or live chat us. Calling is 401-233-4700. So multiple ways to open the account, and it's super fast and easy.
Yeah, you got to do it. navigantcu.org. You're not going to be disappointed. There's just so many tools available on the digital side when it comes to Navigant, and it's just a great interface for somebody who's just getting into their own financial well-being. Molly Pastori, first vice president of marketing and member experience at Navigant Credit Union, navigantcu.org. Thanks for your time today.
Thank you.